Hello and welcome to a quick head to toe. Conducting the physical assessment can actually be done fairly quickly, as the article by Poncar 1995 illustrates. This head to toe is going to take roughly 5 minutes. All of the elements presented in this demonstration will be discussed by your clinical nursing instructor. This video is to be a tool along with your own clinical preparation, clinical experience, and textbook knowledge to help you quickly and safely assess your patient when you first meet them. Having a quick head-to-toe done at the start of your interaction helps you note any gross alterations, plan for a more in-depth focus assessment, as well as provide you with a baseline of information when you're planning your clinical shift, as well as working through the 10 R's to medication administration as discussed by Edward and Axe. Please enjoy the following demonstration.
Mrs. Jones?
Hello.
Hello. My name is Chris. I'm one of the registered nurses.
Hi there.
Hi, I'm going to be your nurse for the night shift. I'm just coming on. So what I want to do is just come in and just quickly introduce myself to all of my patients. Just do a quick assessment of each of them.
Okay.
That's okay? Alright, just want to make sure I have the correct patient. Can you just tell me your first and last name, please?
Selena Jones.
Perfect. And can you spell your last name for me?
Jones.
Excellent. And your date of birth, please?
January 1st, 1990.
Okay. And let me just quickly double check one of the numbers here. Excellent. I do have the right lady.
Perfect.
I see an allergy band here saying that you're allergic to codeine.
Yes.
Do you have any other allergies I need to know about?
No.
Just
that's
that? Alright. Okay, so what I'd like to do is just quickly do a blood pressure pulse rate on you.
Okay.
And then what I'd like to do is just a really rapid head to toe. And the reason I do this is because I'm going to be seeing several patients throughout my shift, I just want to make sure I have a good baseline of where we're starting with.
Okay.
Okay? So what we'll do is we'll check your blood pressure here. Get you to lift up that arm, and I do see you have an IV in there.
Yes.
Was that put in the emergency department?
It was.
Alright. Is it causing any problems, pain, anything like that?
No.
No? Alright. And I'll just get you to relax your arm down here. Perfect. Roll it out. And this is just going to squeeze up here. So you have a really good blood pressure. Your blood pressure right now is 112 on 76, which is what we consider a normal blood pressure. Okay? Just going to check your pulse here.
Okay.
And just nice and calm for just a quick moment here. Okay, and so your heart rate is 68, which is a really nice, strong, regular pulse. And I've also observed that your breathing is nice and deep, it's regular, and you have a breathing rate of about 16. Just going to do a quick oxygen level saturation, and what this does is tells me how much oxygen is in your blood. Okay, and so I'm getting a reading of 98%, which on room air tells me that your oxygen level in your blood is very adequate.
Okay, good.
Just going to do, before going any further, a quick check of my suction and my oxygen on the wall here, just to make sure it's all functioning. And it is. Alright. So, what I'd like to do again is just do a really quick head to toe, just see how you're doing. Take a listen to your heart, take a listen to your lungs and to your stomach, and take a feel of your belly.
Okay.
Now, I understand you came in with some anemia, and it was because you had a bit of a fainting spell.
Yeah.
How are you feeling right now?
I was a little dizzy earlier, but I'm okay now.
Alright, how's your dizziness right now?
It's okay.
Okay, I'm just going to try to lighten your eyes here really quickly. Good, and this one too. Alright, so your pupils are nice and round, they're reactive to light, and about 2 millimeters, which is again a nice normal range.
Okay.
Okay, are you having any headaches right now?
No headaches.
Alright, and just some real quick questions. Do you know where you are right now?
Yeah, I'm at Foothills Hospital.
Perfect, and do you know what year it is?
It's 2016.
How about the month?
September.
And the really hard one is what day of the week is it?
Tuesday.
Perfect, I always have to check that, I work nights, so. Any troubles breathing right now?
No.
No? Okay. Any chest pain or unusual sensations in the chest there?
No.
Okay. And how about in the belly?
No.
Okay. So I'm just going to take a listen to 4 different spots in your heart here. We're going to do 3 from right here. So I'm just going to also feel your wrist.
Okay.
Good. Good. And the last one, I'm actually going to come on your side here.
Okay.
There we go. And just take a nice listen there. All right. So your heart sounds sound really good. Are you having any belly pain right now?
No.
Yeah. Are your bowels working okay?
Yes.
All right. Any nausea or vomiting?
I was a little bit of nausea a few days ago.
Okay.
But
nothing right now. I'm just going to take a quick look at your belly. So what I'm going to get you to do is pull up your gown there. This way we keep you covered. All right. And we'll start with just taking a quick listen to your belly, and then I'm just going to feel all 4 spots in your stomach. There, okay? So you have good bell sounds heard in all 4 quadrants. Things are moving around very well there. Let's do a little bit of tapping here.
Okay.
And just a little bit of pressure here. Now I want you to let me know if it hurts anywhere that I'm poking, okay?
No.
No? Alright. And we'll get you to pull your gown down there. Okay. Before I make you sit up and move around, I'm just going to check your strength here. Squeeze that hand. Squeeze, 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 squeeze. This one too. Squeeze, squeeze, squeeze. Alright. Going to come down to your feet. Push down. Push, push, push. Pull up. Alright, I'm just going to check your pulses in your feet as well.
Okay.
Alright. Your pedal pulses are nice and strong. Alright, so what we're going to do is we're going to get you to sit on up, and I'm actually going to get you to face this wall here just so I can have a quick chance to listen to your lungs here.
Okay.
Now, I do understand that you do have a history of asthma.
Yes.
Are you having any asthma symptoms right now? Any coughing, wheezing, anything like that?
No.
Alright. So I'm just going to take a quick listen to your lungs. I want you to take some nice, full, deep breaths. Breathe out when you're done. You're doing really good there. Couple more spots. Okay, and I'm just going to take a quick listen on the other side of the lung here. Perfect. And on the far side here as well. Good. And the last one, just do a really big deep breath for me. And out. Perfect. Your lungs sound great. I'm not hearing any wheezes or asthma or anything like that.
Okay.
Now, I understand when you were in the emergency department, you had a bit of a cut on your arm. Did they do a dressing on that?
Yeah.
Okay.
It was on my right arm, and I cut myself when I fell.
Any pain there right now?
It's a little tender,
Okay.
but.
So the dressing looks really good. It's nice and dated there. I don't see any bleeding coming through.
Okay.
Okay. Now, I also saw that they had an IV in there.
Yeah.
What I would like to do is I just want to do what we call a flush. So I just want to push a little bit of saline through there to make sure it's nice and working well, that, you know, if we do have to put medication in, that it'll work well.
Okay.
Okay? So do you have any questions for me at this point?
No, I don't think so.
All right. So the nurse practitioner who admitted me put some medications in for 8 o'clock. That's in about an hour's time here.
Okay.
So what I'll do is at 8 o'clock I'll bring those in, give those to you, and that's all the medications that we really have scheduled for you. But if you have any other concerns this evening, don't hesitate to give me a call.
Okay.
I'll come in and see you. That's flowing really well. Is there any pain there?
No.
Okay, so we'll just lock that off. We'll throw that out. What I'll do is get you just to lay back.
Okay.
I'll leave you our call bell, and if you have anything you need, just don't hesitate to give it a ring, okay?
Okay, thanks,
All right,
Chris.
I'll see you a little bit later.
Bye.
Take care.